It's my pleasure to introduce our next speaker. It's Amy. Amy's going to speak with us about West Virginia's activities during COVID-19 pandemic, and including Grow This, the West Virginia Challenge, partnering with local extension, victory gardens, and other best practices. So we get a chance to hear from Amy, and Amy, I'm going to make you the presenter now. Coming at you, Amy.
All right. How are we doing, Ray?
Doing great. Showing up fine.
Great. Oh, good. Okay. Well, we'll go ahead and get started. That way we can move right along. I'm going to talk about the Spring Seed Program and Grow This West Virginia, and then I'm going to go over a couple of other things that our agency has done for outreach. A little bit of quick history on the program. The Spring Seed Program began as a, okay, there we go. The Spring Seed Program began as a district outreach program, and for Ray, if you'll give me just a second, my computer's jumping ahead of itself.
Okay, you bet.
I apologize. All right, I'm going to go backwards some here. It's wanting to jump ahead. So the Spring Seed Program began as a district outreach program, and that was in 2010. We found it as a good way to get out there and build our database and our contacts. And we were able to give out, starting with 250 seeds a year, and now we're up to around 4,000 seeds a year. We also give away 6,000 packs of pollinator seeds. So in 2016, West Virginia University Extension would take a spinoff from that program, and it was named Grow This West Virginia. And they did that with their family health and nutrition program, while the districts continued to do the bulk distribution of the large portion of the seeds. So this year during the COVID-19 crisis, we found that Grow This West Virginia experienced a sudden 500% growth from following years. That was just unprecedented. So you can see here the map with our counties. It just was crazy. And in one day, we had 10,000 signups, and that was April the 7th. And they had to go ahead and close the program then. So WVU Extension reached out to us and said, hey, we could use some help, financially and also, hands-on. So we were able to help them get everything packed, and we were able to get some funding through 319 to buy some envelopes and some mailing materials. But the biggest thing that we found that we needed was through reading the survey that folks took when they signed up for the program, is that we had a major problem. We suddenly had 25,000 registrants, and half of them had never grown a garden before. And if any of you have ever been in West Virginia, you know that it's really difficult to just find a flat place to just till up, to put in a garden. So we thought, okay, we need to get educational materials out there right away, because people are going to be tilling up their hillsides. They're going to be using not very safe water practices, and we wanted them to look at soil and water conservation first. It's great if you want to grow the food, but we have to take care of what we're growing it in first. So we put an action plan in place, and we sourced the 319 funding to get the materials. We quickly designed educational materials and had those printed, and with every packet of seed that went out, that's 100,000 packets of seed, that it was around 4 to 5 packs of seed per family. We sent out these educational materials, and they kind of had a double purpose, because they also served as the cardstock in the envelopes to keep the letters from getting caught in the machines at the post office. So that worked out really well. When we started this out, our cost was around $200, and now the cost was only up to about $500. So this year it did jump up to around $9,000 to get everything done. So with these educational materials, we intend to have prevention of pollution to our streams, prevention of soil loss, less runoff, and of course knowledge, because knowledge is power. We also needed extra hands to pack the seeds. So I myself, I know, packed 750 seed packs from home during social distancing, and we are still practicing that. So these are the brochures that we put together, a front and a back and a front and a back. This was used to mail, and it was used for our social media platform, which worked out really well. We had engagements on day 1 of 1,813 people. On day 2, we had 39. And then on day 3, we had reached 3,450 people with 365 engagements, which is post clicks, 21 shares. So in total, we ended up with over 5,000 with just our social media reach alone, which I was really happy about. So we do have to have continuing plans, and our continuing plan is to follow up and be available to families, to post soil and water health workshop videos to YouTube, to have live soil and water health workshops on social media, because the live links really do work well. And we've done that also with our education program. We've done some lives and basically held class through the Facebook Live. So we're going to email educational brochures and post to social media for a broader reach. And that we're going to base that on the time of the growing season. Right now, we want to get people to not just till up the hillside and let it wash down into the stream. So that's kind of our focus. And then we're going to look at nutrient management in another week. We're also going to have referrals to the local conservation districts for program information as needed, because there is a lot of programs that we have in West Virginia that are kind of unique that serve smaller landowners. So we're really excited about that. So also during these trying times, we got the 3D printer out and decided to try to help our frontline heroes. And so we warmed it up and we created mask extenders, which are also known as ear savers, bias tape makers, and other needed medical equipment. And that was actually a connector box for infant feeding tubes. Those were in short supply in West Virginia, so we were able to print out several of those as well to give to NICU babies to cover their feeding tube. The mask extenders, if you've never heard of them, relieve the pain that medical workers face from the elastic that goes behind the ear. And we did, so far to date, as of last night, we've printed over 1,200 mask extenders, and they've been sent to medical care workers from 3 different states. A lot of our medical care workers in West Virginia went to Ohio and to New York to work as support, so we were able to send those with them. And we've sent 70 bias tape makers across West Virginia to folks who are making and donating cloth masks. So that's really exciting. And I know not all conservation agencies and districts have 3D printers, but we use our 3D printer with the soil tunnel trailer, and we use it for printing microbes so that when we were teaching visually impaired students, they have a tactile learning tool. And that was purchased with an agriculture innovation grant. So I was really grateful to see that medical care workers were so grateful for the ear savers, that they did post feedback to our social media. So that was kind of a little confirmation that we were doing a good thing, and I was really happy to be able to help them with that. And you can see here where the ear saver works. This is one of the COVID-19 nurses here in Charleston. And that's all I have for right now, Ray.
Amy, thanks so much for giving us even more good ideas and the work that you're doing during this COVID-19 pandemic. And appreciated you extending that to also the healthcare workers and others, the work that you're doing there.